So, without further delay, I invite Dr. Margaret Kay to set the scene and introduce your family to you.
Thanks, Donata, for the introduction. And right, how do I work this now? Do I just press this button that you never pressed that just made it move on all by itself? Like that? Right. You just moved it twice. There we go. Okay, now I'm moving on. Right. Okay, it's nothing like new technology, and it's all very exciting because we've got so much teleconferencing stuff happening in the background that's sort of interesting that we're extending our sort of educational services well beyond just our little room here, although the initial little room that we used to have would never have fitted this many people here, so thank you so much for coming. So just to orient everyone that generally speaking, most refugee healthcare actually happens in the primary care setting. In the primary healthcare setting, we provide comprehensive care, continuity of care from cradle to grave. We deal constantly with complex care. And so not just one health issue and not just disease, we deal with illness, we deal with support, social situations, and of course all of that involves coordinating care as well. So this is just what we generally do in primary healthcare, and clearly this is very relevant in delivering refugee healthcare. It's person-centred care with shared decision-making. Just think about this with refugee healthcare. It involves the care of the whole person, care for the family. It involves diagnosis and treatment. And we often do it with very limited resources. And this can be quite tricky when you add the dimension of cross-cultural care as well. So we have a family that's arriving in Brisbane, and this is Ali and his wife and children, and they're refugees. They're of refugee background. So who is a refugee? So this is the UN definition, and without sort of reading every word of it, it's what we're actually describing. We take this as our sort of, I suppose, foundation of understanding refugee and refugee healthcare. So people who are refugees are people who have left their country because they've actually had a fear of something that's been significant in their life, and they then apply as asylum seekers to be refugees, and then they become accepted as refugees through the UN. So it usually doesn't match, this definition doesn't match with much of what you read in the media. It's very important that we all stay informed. So that's the main reason for that slide. So we need, as clinicians, to understand the refugee journey, to understand the settlement system that's relevant to us and the practice that we're working. So for me, that's in Brisbane, but for other people, it'll be in other parts of the state. And in fact, nationally, it's slightly different in different places. We need to know what happened before people arrived, and we need to know what happens to people after they arrive, not just from the health perspective. So this family are of Somali background, but they've been living as refugees in a camp in Kenya for the last 10 years, and that's not me making that noise, just by the by. Yeah. So if anyone joins us on the teleconference, could we ask you to mute your microphones just to make it, because otherwise we've got the speakers on here and we're going to hear every bit of washing up, just so you know. Okay. So they've had very minimal access to healthcare, and they've also had very minimal access to education during this time. And as part of the process of coming to Australia, they've had to have a visa medical. And the visa medical consisted of a form of a medical examination, which varies in different places. They certainly, if they're over 11, had a chest x-ray to check for TB. And they also, if they're over 15, had an HIV check, and more recently a syphilis check. And then they may or may not have had some other checks, but it varies enormously in different areas. But the other ones are the consistent things. Sometimes we've done pregnancy tests, sometimes we've done some other checks. So occasionally, particularly for minors, we might have done a hepatitis B check. But these things are not necessarily the things that we might have expected that people have had. And even if you have a significant health condition, you're still allowed to come to Australia. It's not that that's a barrier, because these people are applying as humanitarian entrants. And because we see this as a humanitarian duty, we accept people with all sorts of health conditions, even when they're complex needs. What we don't accept is people who have got cavitating TB who might actually be a public health risk, and we then actually voluntarily treat people until they're healthy enough to be able to come. So there's a lot that happens after that. So what we've discovered is that this family is now going to arrive, and we know that Ali's been diagnosed with TB. He needed to have treatment before he came, so the whole family were delayed, and they eventually decided that he was treated adequately and he's now allowed to come. So they were about to board the plane, and a couple of days before they boarded the plane, a lot of other people who were going to become people settling in Australia all gathered, and they were going to go for a health check just before they leave. And that's because a number of people have become acutely unwell on the aeroplanes, and we don't want that happening. So we actually do a physical examination. We particularly look at people's legs, which is interesting, and rub a bit of betadine if something looks like a little worm might be popping out. Clearly, this is not necessarily the best ever medical decisions. These are responsive decisions that the government has decided to do because these things have actually happened. So if the chest x-ray has been positive, like Ali's, he would have had another chest x-ray to check that it's okay for him to travel. Everyone gets a rapid diagnostic test for malaria. We've had so many people with acute malaria as they come off the plane, and one little baby died in Sydney within 24 hours of arriving. After finally getting here, to lose your child is just a terrible tragedy. So vaccination, everyone gets an MMR. A whole plane load of unvaccinated people arrive with one person coming out with measles, not a good thing. So now everyone gets an MMR before they get on the plane. So you can see this is a fairly reactive approach, but they've added a few things, like some people get an ADT, some people get polio, but not always. And obviously if people are travelling from countries like Sudan, they might have yellow fever. And they get albendazole, just big dose if you're over one. And they may or may not have a pregnancy test, so that could be important. In this case, we did have a pregnancy test, and we now, well, probably didn't have a pregnancy test. We probably just asked in this case, but that was a good test. Because things change. When you're initially applying in your visa medical, 6 months later, you may or may not have been pregnant, but you're pregnant now. And so things change. So there's also a potential need. It was identified at this check that this family has actually been through an awful lot. All refugees have been through an awful lot, quite frankly, but there's a potential need for torture and trauma counselling that's been identified here, so we flagged that. Now, it depends where in Queensland you actually arrive as a refugee as to how you are supported in the settlement process, but there is support for you. And obviously the healthcare service integrates to some extent with that settlement service, and we've been trying to increase that integration, I think, fairly successfully here in Queensland. And so this particular family is going to arrive in Brisbane, and they're going to arrive on a fairly common refugee visa, Visa 200, and they're going to be settled in Sunnybank. So the case manager knows that, and a bicultural worker will actually meet them at the plane. They're going to have some assistance with their housing, and when they arrive at their house, they should have some food for a few days that's culturally appropriate. They'll be assisted to get Social Security with the healthcare card and also Medicare. They will arrive as permanent residents. Refugees who are processed offshore are permanent residents from the moment they arrive and entitled to everything. So, a family has arrived at the practice, and they usually come to the practice with a bicultural worker to show them the way to get there and to facilitate anything that needs to happen when people actually engage initially with the practice. And we now have the person arriving, in fact the family arriving of a number of people, and we have the administration team, the nursing team and the doctors all ready. And so now we're going to hear what happens with the